Thank you very much for these kind words, Conchita, and I'm delighted to be here. So I want first, of course, to thank the organizers of this event, the University of Luxembourg, and in particular Conchita, who has been instrumental in organizing this event, but also the EIB Institute for welcoming me today at this conference. So the topic of my talk today is going to be, since the topics of the talks are about inequalities, and I'm going to talk about inequalities in the context of the Better Life Initiative, which means that I'll talk about inequalities and well-being today. So first, let me start by telling you a little bit more about this OECD Better Life Initiative. The OECD Better Life Initiative is actually a program to develop internationally comparable measures that allow to look at the well-being of people in mainly OECD countries and a few big economies, big emerging economies. And it was launched at the time when the OECD celebrated its 50th anniversary in 2011. And at that time, we had a lot of introspection at the OECD. We did a lot of reflections on why is it that actually we didn't see the crisis coming. We probably didn't provide the right policy recommendations to governments. And why was it also that we could see already some populism and populist movements taking up in OECD countries? So there we had these reflections, and we thought that, well, perhaps we had the wrong compass, because we had been looking at GDP as the main economic compass to assess countries' performance, forgetting about the fact that things are more complex, and in particular, what you see in GDP does not necessarily reflect into the situations of people themselves. And so we put at the time the well-being of people at the center of the mission of the OECD going forward. And so we redefined our growth narrative and saying, you know, growth in GDP or even GDP per capita should not be the compass. We should have another broader GPS to look at the performance of countries. So that brings together a number of new methods, new outputs, new methodological work, and in particular, new measures. Because if you want to know the situation of peoples, you need to find out, you know, what's life for them. How do they view their life? And what is important to their lives? So that you can then provide better, more informed policy recommendations to countries. So at the time, we developed a new framework about well-being based to a great extent on the recommendations of the Stiglitz-Sen-Fitoussi report that was published in 2009, which was about going beyond GDP, actually. And we also got inspiration from a number of initiatives that were ongoing in OECD countries at the same time as the OECD was reflecting on its mission and what it was supposed to be doing. And we came up with this framework. So I'm going to spend 2 minutes explaining what this framework is about. So it focuses on individual well-being, and it has two broad domains. So what you see on the right-hand side are material conditions, but not material conditions as GDP, as the economic system, but material conditions for people, okay? So their income, their wealth, their jobs and earnings, and also we put housing there because if you don't have proper housing, it's very difficult to actually find a job and live a decent life. Then on the right-hand side, we added dimensions which often are non-monetary dimensions, non-material dimensions, and they refer to quality of life. And there we added health, we included health, work-life balance, education and skills, social connections, which are very important for people. Interacting with others is found to be very important for the quality of life of people. Civic engagement, meaning how do people participate in public life and governance? How do they have a say? Do they have a say in the way government act? environmental quality, the air you breathe, the water you drink, etc. Personal security, whether you are able to walk outside at night and feel secure. And importantly, subjective well-being. Because after all, if you want to know how people feel about their lives, the best thing to do is to ask them, right? So we added that. And we said, okay, so this is, so that interacts, of course, with GDP, in particular on the material conditions, and also because if you have growth in the economy, you may achieve some of those other outcomes in quality of life. But you don't have certainly not a one-to-one relationship, because you can grow at the expense of many of those dimensions. For instance, the environment, of course, being one of the most often cited, but also social outcomes. But that's for current well-being, which means well-being today. But we also thought about sustainability, because you can also achieve current well-being today at the expense of tomorrow's well-being, the well-being of your children. And so to maintain and preserve well-being over time, you need to maintain some capital, and you have to have a capital approach. So you need to preserve different types of capital, such as natural capital, obviously, but also economic capital, because you can run a lot of debt, and then your future generations are going to pay back this debt, for instance. Human capital, if you don't invest in human capital, then it is at the expense, it will be at the expense of the well-being of the future generations, and social capital. So that's basically the framework we've been using, both conceptually, but then we have populated this framework with indicators. And some characteristics and guiding principles, as I said, we're putting the focus on people, not just the economic system. Importantly, when we chose the indicators to populate this framework, we focused on outcomes, not inputs or outputs. For instance, it's not how much you spend on health, but whether people are in good health. Not how much you spend in education. Of course, it's important, right? For policy making, it's important. But for the people, first, they would have to be taxed to pay perhaps inefficient services. So that's also very important to, at the end of the day, to measure the quality of that education. So the fact that it's on outcomes is a very important aspect of this framework. We try to capture both objective and subjective measures, aspects of life, as I said. We're concerned with well-being both today and tomorrow, and importantly, and that's what in red here, in this circle, or this oval, we try to look not only at averages in these dimensions, in these outcomes, but at distributions. Because as for GDP, GDP tells you what's happening on average in the economy, which means it doesn't tell you anything about people. Even in these outcomes, if you only look at the average, you don't know who is better off and who is actually has the greatest chances in life if you don't look at the different groups in the population. So when we chose the indicators to populate this framework, we had also some guiding principles. Of course, the quality of the indicators, so most of the indicators come from official statistics. We also wanted to ensure that they could be disaggregated so we can look at inequalities. And importantly, that we could look over time because we want to see whether countries improve or the situation of people improve or not. So there were a number of criteria that guided us in choosing the indicators that will then help us assess the performance of countries. And of course, for us, because we're OECD, one important dimension there too was that we had comparable indicators following standard international standards, and that the coverage was broad enough to cover all OECD countries. So then with this, we have, sorry, I went too fast. Yes. So we have different outputs for different audiences. So we did some, of course, when we realized that those are the indicators we wanted, some were well documented, we had the indicators at hand, some they're still missing information. So we conducted a lot of research and methodological work, for instance, to help countries collect subjective well-being indicators. When we started, we had very few countries collecting subjective well-being indicators. Now I'm proud to really say that after we've produced our guidelines on how to measure in a comparable way and in a scientific way subjective well-being indicators. Apart from 2 OECD countries, all OECD countries now collect regularly subjective well-being indicators. So we're helping countries develop the infrastructure, the statistical infrastructure, if you wish. The same is true for wealth. As you know, wealth is very income. We have lots of data on wealth. It's more complicated. Anyhow, we're doing research and methodological work. We report on these indicators regularly. And as Conchita mentioned, we try to have some communication tools so that we reach the broader public. And after all, we do that for people to see how they are. So it's very important that the people find the information that they need. So it's not just for governments, but it's also for citizens and researchers that can then continue to exploit these rich databases. So today at 11 o'clock, while I was on the train, we released How's Life 2017. So it's just fresh, hot off the print, as we say. How's Life 2017 provides an overview, so it gives you a picture of well-being according to this framework in all those dimensions and indicators for OECD countries, both for current well-being and for the resources to maintain well-being over time. It also contains, on average for the OECD and across countries, looking at comparing countries' performances, but also provides detailed country notes, country by country. So, for instance, you will find in this a little 4-pager on how's life in Luxembourg, but you're not all coming from Luxembourg, so you will also find your own country. And then we have 3 thematic chapters, which dig deeper into some of the issues. One is on inequalities in well-being, and I'm going to present the results of this chapter. Another one is on migrants' well-being, and I will say a word on that as well, because, you know, the situation of migrants is one form of inequalities between migrants and the native people in a country. And we have also a chapter on governance and well-being, and I'll say a word on that as well. So, as I said, the inequalities chapter, but how's life more generally, explores well-being divides, inequalities in well-being. Among countries, comparing strengths and weaknesses across countries, changes over time since 2015. Within OECD countries, including by different population groups, men and women, old and young, lower educated and higher educated people, rich and poor in both income and wealth, and migrant status, as I just mentioned. But also it looks at the divide between people and the public institutions that are supposed to serve them. Because at the end of the day, if you don't, governments, after all, the fact that there are divides and inequalities, I am not the one to tell which level of inequality is optimum. This is a normative. And I don't feel like I can say anything, nor the experts working at the OECD. On the other hand, you can show the picture in your country. And then, of course, society will then decide whether this is acceptable or not. But certainly, if there are divides and profound divides, and if those divides are maintained over time, persist over time, then there is a risk that democracy itself can be affected. And as we've seen in a number of countries recently. And that's why? Because there is a feeling that the government is not doing enough to reduce those inequalities and is not addressing the needs of people. So this is why it's very important to look at the divide between people and public institutions and understand what is driving this divide and address it if necessary. So when we measure inequalities, we have to think about how are we going to go about, because this is multidimensional, so it's complex. And the way we do it is that we don't focus on income only, which is, you know, lots of have been said about income inequalities and even wealth inequalities after Piketty and so on. But we look at inequality more broadly, because it can touch every aspect of people's lives, as I'm going to show. But we ask ourselves, inequalities of what? What are we talking about? Which outcomes? Okay? Inequalities between whom? You know, the bottom or the top and the bottom and the top of the distribution across population groups. The overall distribution, or are we talking about a threshold below which you think people should be, the focus should be concentrated? Are we looking at inequalities today or the one that persists over time? And are we looking at inequalities of outcomes or of opportunities? All these are different questions around inequalities. And so we've decided to look at all of those, actually, which we say are inequalities. Some are vertical inequalities. So you look at the gap between the share of the population at the top and the one at the bottom of the distribution, whatever the outcomes. Or horizontal inequalities. There you concentrate on differences among groups in the population, as I said, by gender, by age, or by educational levels. You can look at deprivation, and there you focus on the low end of the distribution, and you look at those people, the share of the population that falls below that threshold, poverty, for instance, in income. And then outcomes of opportunities. Are those inequalities due circumstances that go beyond the person itself, like a child living in a disadvantaged household? The child cannot do anything about that. The child lives in that disadvantaged household. Or is it a question of efforts or choice? You know, a PhD student that decide to go to university with a very high degree, rather than going to become, someone working in the financial market or in the data business these days, it's a choice. So there will be inequalities in those incomes, but if it's by choice, who are we to say that it's bad? You know, we have to respect this. Finally, something that's not there too is very important to look at inequalities over time. That means that if you are in a deprived, for instance, situation today, perhaps you have a chance to evolve over time. And then it's maybe less of a problem. You may be in a low-quality job today, but if you have the opportunity to get a good job tomorrow, this is less of an issue than if you are trapped in that bad job. Or intergenerationally, meaning that if these inequalities persist across generations, that means that children today, for instance, will have children of tomorrow, if they will be adults tomorrow, if they have had deprivation in their childhood, that is going to affect their future tomorrow. So all those types of inequalities are important. So if we look at vertical inequalities, which we look at the dispersion of outcomes among individuals within a society, we usually look at the Gini index, for instance, for income inequality, or in other dimensions, the S20 over S80 ratio. That's how we measure it. How big are vertical inequalities in OECD countries? Well, if we compare people at the top 20, in the top 20% of the distribution, and people in the bottom 20 of the distribution, we find that the time in the top 20% of the distribution, they spend time on the time they spend on social activities is 11 times higher than those at the bottom end of the distribution. We find that household disposable income is more than 5 times higher. The feelings of having a say in what government decisions is nearly 4 times higher. Life satisfaction is twice as high. Time devoted to leisure and personal care is nearly twice as high. And if we look at other measures, we find that the standard deviation in age at death is more than 13 years in between the top 20 and the bottom 20. And looking at wealth, just 10% of households own more than 50% of total wealth. The concentration of wealth is much, much higher than it is for income. So now let's zoom into different countries, and let's look at which OECD countries have the lowest vertical inequalities. So we looked at the indicators, and we classify countries into three tiers. The one which have lots of indicators where they are always lower than the others, the middle, and the top. So the most equal, the sort of average, and then the least equal. And of course, I mean, to some extent, you find, as always, at the right, on the right here, you find the Nordic countries having the lowest, comparably lowest vertical inequalities, which, in a sense, not too surprising, I would say, within countries, if you look at that. Although, on the other hand, look, Luxembourg is in red here, so I highlighted Luxembourg. So it's a very prosperous country. That prosperity is not shared very equally. Luxembourg is among the countries, among the most equal countries, for only around 20% of our well-being indicators. And you find, and of course you would find Israel and the US as the least equal in terms of vertical inequalities. And then you would say, well, but perhaps this is just mirroring income. So why are you bothering with looking at all these dimensions and all these aspects? Because once you have captured income inequality, then that tells you everything. Well, in fact, that's not true. The Nordics do well in income inequality, and the US do badly in income inequality. So does it translate into inequalities in other dimensions? Well, not quite. Here we look at the overlap between income inequality and the other types of inequalities, okay? Age, skills, work-life balance, earnings, political involvement, and so on, and life satisfaction. Where if you look at this, then you can see that some countries are in the same third, which means they are both low income, low inequality in income and low inequality in others, but not all. And so what you see, for instance, the countries who are the most equal in terms of age of death are rarely those who are the most equal in terms of income. So there is not a one-to-one relationship between income and health, for instance. So that's why it's important to go deeper into looking at those inequalities individually and not think that income will be the main determinants of all of this. Only in the case of life satisfaction is there a high correspondence between income and inequality and inequalities in life satisfaction. For the rest, it's never, and it's far from being one-to-one. So how then, the question you can ask is an unequal country more or less likely to show an average, a good or bad average in terms of overall well-being? And this chart tries to link the performance, overall performance in well-being, average well-being, with the level of inequality. And here you can see that some countries combine relatively high performance with relatively low inequalities. And again, you find the Nordics there. High performance, low inequality. Other countries, low performance in well-being, high inequality in well-being. And there you find Mexico, Hungary, and Latvia, and even Portugal, actually. But then you have a bunch of countries, lots of countries in the middle, where you can see countries, that are spread out. But importantly, what you can see as well is that there's nobody there. Here. There's no one almost there, and there's no country there too, which means that no country actually manages to combine a high level of performance with a high level of inequality. Okay? And none of the poorly performing countries actually have low levels of inequality. So there is an interesting relationship here that needs to be explored more in the future. What about now horizontal inequalities in well-being? Across population groups, population that have common traits, people that have common traits. So gender, age, education, migrant, and so the region also where people live. So if we look at horizontal inequalities and we look at gender divide, and we look at this indicators of well-being that populate our framework. Okay, we see that women are worse off than men in a lot of things that deal with employment, but also they feel the sentiment of security is much less than those of men. And they also report, interestingly, they have a higher life expectancy, but if they ask them whether they are in good health or not, they have a tendency to report a lower self-reported health status than men. For many of the indicators, it's about the same. Women are better off than men in time spent on social activities. They socialize more. They work, of course, less long hours than men, and less homicide rate. They are less likely to be killed by homicide. But this one, for instance, we have to interpret it very carefully, because women work less longer hours than men, but that means as well that in terms of work-life balance, because men are at work for longer hours, they're not at home to help the women share the household chores. So where are in the OECD women least disadvantaged? Where, we see that, again, we find the same, usual suspect, the Nordic countries here, and Norway, Finland, Denmark. Meanwhile, Hungary, the Netherlands, interestingly, and the Czech Republic are among the countries which are the least equal. If we look at by education now, the divide by education, and again we look at indicators which are in our framework, those for which we have a decomposition by indicators. This is to be expected. Secondary educated people are most of the time worse off than tertiary education, except again for working long hours, where the most educated people spend longer hours at work. Countries, if we look at country level, there the picture is a bit different. It changes. We still find Sweden, but we also have Switzerland, Spain, Estonia, Turkey here, where there is least difference between lower educated and higher educated, whereas Israel, Slovak Republic, and Chile are the countries where you find the most inequalities between lower and higher educated people. Generational divide, young and old. There the picture is a bit more dispersed. Of course, the younger are worse off than middle-aged adults in economic factors, which is more or less normal. Although on unemployment, you would wonder why this younger generation, between being better educated than their parents, why are they doing not as well as their parents? But you also see that they're not so much interested or less interested than adults in participating in civic activities. But on the other hand, they spend more time on social activities and more time on leisure and personal care. We can look at countries. We will find the dispersion by countries. I'm not going to spend too much time. One horizontal inequality that we focus on in this report is to look at migrants versus native people in countries. And we try to look at why do we do that? Because, first of all, in Europe, of course, it's been very important, but that's recent. Here we look at the migrants that are defined as people living in a different country from where they were born. So we have the stock of migrants. And in OECD countries, on average, 13% of people are actually from migrant origin. In Luxembourg, as you know, it's 40%. Migrants are very diverse between OECD countries, including because they come from different background. Estonia, Poland, and Greece have a relatively high share of indicators falling in the most equal third of the countries that are the most equal. And the best result for Luxembourg in terms of horizontal inequalities, but it's the best result. I mean, there's a good result for Luxembourg here, actually one of the best. in terms of migrant, meaning that there's not much inequality between the migrants and the native-borns. So, on the other hand, we find that across OECD countries, migrants face multiple disadvantages. The median income of migrants is lower than, and the wealth of migrants, of course, is also lower. They are more likely to work antisocial hours and be in low-paid jobs. 30% of migrants have a tertiary degree, with a tertiary degree actually overqualified for their jobs compared to only 20% for the native-born. They're more exposed to pollution. They report worse health, lower social support. They have a lower life satisfaction than the native-borns in most OECD countries. If we do a focus on deprivations now, if we look, for instance, at a number of deprivation based on the threshold, we find that 37% of people are exposed to, PM 2.5 particles higher than 15 micrograms, which is the threshold that has been set up by WHO. That 31% do not vote, that 26% do not feel safe walking alone at night where they live, that 13% of people report more negative than positive feelings in terms of subjective well-being, that 11% spend more than 40% of their disposable income on mortgage and rents, and then some people feel very isolated, and 8.5% have absolutely no friend or relatives to count on in times of needs. Here it shows the low deprivation rate. Again, we find the Nordics and the same, it's kind of more or less the same distribution. Here we have done something which is very interesting. We've looked at not only poverty today, but the risk of falling into poverty. Currently, there are 10% of people who are poor in OECD countries, measured in relative terms. But we found out when we look at when we combine income and asset poor, we can see that 40% more would fall into poverty if they had to forego 3 months of their income. So they don't even have enough savings and assets to live for 3 months if they had no income whatsoever without falling into poverty. And that's OECD countries. We're not talking about developing countries. So let me almost finish with the distance between people and the public institutions that serve them, which also, as I said, is very important to look at. In the OECD, only 1 in 3 people in the OECD feel that they have a say in what the government does. In other words, they feel that the government does whatever it wants, but it doesn't really respond to their needs, and at least they cannot influence what the government is doing. We don't have data for Luxembourg on this, but you see, interestingly, France, which is your neighbor, and my country, is the country where you have the lowest trust, essentially, or the lowest feeling about the fact that you can say something about the government or you can influence the government. Even Germany is rather low. Now, if you look at this, if you combine this with the people who have the fewer economic resources, are the ones that feel the most disenfranchised, not being part of society, being disempowered. So there is a sense that the people, for instance, that have a low, less than secondary education, feel even more that they don't have a say in government. The unemployed feel that they do not influence the government, and the poor in the bottom quintile also feel that they are the more disenfranchised. So if we look at how does it translate into how people vote, well, you can see that the people who are essentially rich in all those dimensions, income, education, employment, are more likely to go and vote than the ones that are, again, more at the bottom of the distribution. So, do politicians represent the people they serve? Well, we could gather statistics for 11 countries, and we found that manual, agricultural, and service workers make up 44% of the population at large, but only 13% of the members of parliament on average in OECD countries. And here you can see the distribution by countries. So, to some extent, that's not it's not so unusual. But that also is a reflection of the fact that people don't feel represented in public institutions. Briefly, changes in well-being over time. The report shows that in some aspects of life, the average OECD resident is better off than in 2005, but progress has often been slow and unevenly distributed across countries. And in some areas, we are even falling behind. So we can see that in earnings, there have been a rise since 2005, so before the crisis. But in fact, on average, since the crisis, the increase in earnings has been less than in the previous years. There has been an increase, of course, in life expectancy, in feeling of security, in employment. But in some others, in particular, labor market insecurity has increased rather than decreased. So even if employment has increased, there is a sense that labor market insecurity has increased, long-term unemployment has increased, social support, the lack of social support has also been increasing, and well-being, subjective well-being has declined. So what I mentioned to you, it was the average for the OECD countries, but as I said, we look at different countries. The diversity of countries is very large, and so we present, I'm not going to go through them because I want to have time to answer your questions, but you can see we look at the percentage of countries where we have seen an improvement in some in inequalities in those dimensions, no change or a deterioration. And there's been improvement in some and deterioration in others. So the picture is also mixed when we look at the resources and risk for well-being in the future, in terms of greenhouse emissions, in terms of the share of people who smoke or who are obese, and so on. So you can find in the report also country details, like in Luxembourg, it's presented this way, so it's normalized across countries. So you can see the closer you are to the upper rim of the circle, the better the country performs in those indicators. And the closer they are to the small circle at the center, the worse they perform compared to other countries. And so you can see for all countries, if you want to compare, this is an element of comparative analysis across countries. So you can see where Luxembourg does well, of course, in income, but does less well in PISA scores or in education or in housing. You can also look at Luxembourg in terms of inequalities compared to other countries, and we have a dashboard that allows that to do, or the situation of migrants according to the different indicators as well, where migrants have a worse situation, essentially almost in all dimensions, the same situation or better situation, and you can do it by country. So what's the bottom line? The bottom line is that House Life 2017 shows or attempts to give a picture of the many faces of inequality. In other words, where you were born, the country you live in, your gender, your age, your education are actually crucial factors affecting well-being. Migrants usually experience well-being in lower well-being than the native. Native born. But the problem is that, of course, like with the very poor, those are populations that are very difficult to capture in surveys, so it's probably underestimated even. Many people in OECD countries feel distant from the public institution that's supposed to serve them. And since 2005, some aspects of well-being have improved, but some elements, and in some countries, are feeling left behind. So with this, I thank you.